hair care and welcome to today's live. Just getting my notes up for today. I just wanted to announce it's been a week. Unless it was a week yesterday and I completely forgot, but it's been a week. I am so ecstatic that it actually happened, that I have been coming live every day to answer your questions as I promised. My name is Djanie, and I am an advanced hair, scalp and skin practitioner here in Leicester in the UK. I offer treatments, advanced treatments for hair, scalp and skin, and I fix people's hair and their scalp and their skin with any problematic issues that they may have. I also coach professionals within this space who are wanting to advance their techniques and also perfect the treatments and offerings they have for their clients. That's what I do so far. And I have been coming on to answer questions and also just give some educational factors and elements to some issues that people have. I caveat all my videos by saying that I am not a doctor, I am not your doctor, and I am also not your GP. Any issues that you're facing, it is always advised that you contact your own GP and seek advice from there. And neither do my advice and videos replace a consultation. So a professional consultation is still important, even though you're going to learn a lot from this. I still encourage that you get a bespoke, tailored consultation that will help to identify the ailments that you are going through. Today, I will be talking about some questions that I get in the studio. So in my clinic, these are some of the questions that come up, some of the ailments that come up, and I'm following through with that. And the first question I want to debunk and answer is when clients ask how often they should wash their hair. So if I'm looking over here, it's just because I've got some notes and I want to not forget where I am so that I can remember all my points. Okay, how often should I wash my hair? I have mentioned in the past that the scalp is essentially what we should be focusing on when we're washing our hair. By washing your scalp, you naturally will wash your hair. You cannot avoid that. They coexist together. But when you're intentional in making sure that you're washing your scalp, it helps for you to make sure that you're actually doing what the activity is catered to do. So the activity of washing your hair really is about washing your scalp, not the hair. So if you change that mindset into thinking, I'm not going to wash my hair, I am going to clean my scalp. It seems unusual for someone to say, oh, today is my scalp wash day. Mostly we say, today is my hair wash day. We're washing our hair. But in trying to make sure that you do the right thing for your hair and scalp, I want to change the way you speak, or the way we speak about our hair and scalp, so that it fosters a certain behavior that actually helps us overall. So we cleanse our scalp and we naturally will end up washing our hair. Okay, so how often should we do that? I say that the scalp is the extension of the skin. You wash your face or your skin very frequently. People do it every day and sometimes even twice a day. And yet we don't do so for our hair and scalp. You cannot wash your hair too often. It's almost impossible to say that you're washing your scalp too often, because naturally people don't wash their scalps often enough anyway. But I usually say if you wash your scalp and your hair about 3 times a week, that is sufficient. Okay. But if you're doing certain activities that require you to wash your hair more frequently, then that's what you should do. You should wash your hair frequently. If you're engaging in certain activities such as swimming, for example, or you go to the gym a lot, and so you sweat in the scalp, or your job is taxing in the way that the environmental factors within the work environment affects your hair negatively, then you should wash your hair more often. What I sometimes do for clients who come in who have highly taxing jobs that have polluted environments and want to continue, they want to have a hair care journey, or they want to have a hair length retention journey, I may prescribe certain treatments that helps to combat the strain that perhaps excessive washing or excessive cleansing of the hair may have on the hair itself. Because sometimes the worry is that you overwash the hair and then you end up with dry hair. And so by putting these measures in place, it helps to ensure that if the client needs to wash their hair and scalp more frequently, that they do not experience the outcome, the undesirable outcome of having to wash their hair so frequently. But realistically, three times a week is good. If you have to do it more often, then you have to do it more often. I'm wanting people to get to the point of understanding that you may have to wash your hair more often than you think. Because if you're engaging in these activities, you're going to the gym more often, you're sweating in the scalp, there's salt residue built up on the scalp. Salt in itself can become drying to the scalp. And so that must be cleansed off. And with patients and clients who are struggling with washing their hair frequently, the advice that I pass on is you can use a wet flannel that you may put some shampoo in and reveal the scalp. So you part your scalp in several places, reveal it, and just wipe it down with the towel to clean that scalp and prepare that scalp for you to be able to live in that state until you can wash your hair. It isn't ideal, but it is a way that can help people, and people have found it quite helpful when they do that. Okay. The next point that I want to make is about, should I use oil on my scalp? I had a lady today at the clinic, and she wanted to have her hair braided. She is experiencing some hair loss. She's fully aware of that. She's a new client, but she came in to see me, and she had drenched her hair with so much oil that it was running down her neck. And she actually said that she pardoned me by not using as much oil on her hair and scalp. That ordinarily she actually uses much more oils on her scalp than this. And this is a woman that's experiencing hair loss. And so I had to advise her and let her know that, definitely using those oils is not going to be the ideal thing for you ordinarily on a normal day with the average person, but certainly not when you're experiencing hair loss of any kind. That oils do not help in what they in what they seek to, or what you seek for them to achieve for you, it will not be helpful for your hair growth journey or to reduce the signs of hair loss. Because oils can become occlusives, and people's understanding as to why they're using oils is, I'm trying to not say things that may come across, because we are lacking in education in certain things, our behaviors match what we do. People don't intend to do these things to damage their scalps, but by virtue of the fact that they do not have the right education on the subject area, they will do what they can or what they think is right. Sometimes it's a cultural thing. It's just how they've been living, how they've been brought up. And it has this nostalgic feeling when they are using these oils and coconut butters and things like that without truly understanding why they're using it. Okay, so oils have no place on your scalp. Formulated oils that have been specifically formulated pharmaceutically for your scalp may be something we can talk about, though I find it very strange if there's ever going to be a situation where a cosmetic chemist would formulate an oil for the scalp. But if they did, I guarantee that it wouldn't be 100% occlusive oils that should be placed on the scalp. And if they did do that formulation, I can almost guarantee that it wouldn't be designed to be left on the scalp for a prolonged period of time. So until I get an updated education or opinion on the matter, I will say that oils are occlusive to the scalp and we don't use it. They attract dirt, they attract dead skin cells, they don't allow it to be moved out of the skin, of the surface of the scalp. They don't help in the fact that they attract those dirt and debris and, you know, all the matters that we're trying to get out of the hair, but they attract that to the scalp and leave it sitting there. And as the buildup in itself naturally starts to block those pores, those hair follicles that we're really trying to get clean and retain that ecosystem to ensure that the scalp is a conducive area for good hair growth, good quality, highly resistant hair growth. So no oils on the scalp. And if you are putting oils on the scalp, not for a prolonged period of time, a maximum of under an hour, half an hour will be sufficient to get that physiological feeling or relief that you're looking for from the product. Okay, so if it's to soothe something on the scalp or to aid lubrication or provide slip for massaging, for example, that would be the kind of thing that you would use it for, and it would stay on the scalp for a short period of time, and then you would wash and cleanse that off. And then I want to talk about the oil options. So if you must use an oil on your scalp, the only oil that is closer to the natural sebum of the scalp, so our scalp naturally creates sebum. And I've got my trusted model here to show you what the scalp, where that sebum comes from. So if you've ever heard anyone speak about sebum production off the scalp, this is what it is. Okay, so this is the natural oils. It's waxy in substance, but it's on the scalp and it sits there. It helps to create a really beautiful pH balance to the scalp, where the scalp is at its happiest point of 4.5 to 5.5. And It is great in protecting the hair itself also. It coats the hair and helps the hair become resilient. Okay, and so sebum is produced by the sebaceous glands. So we've got, this is the hair follicle. The hair follicle is tubular. It runs all the way down that stratum corneum, that epidermal layers, those epidermal layers, all the way down. Okay, so it's a tubular, and that's part of the skin. Okay, one moment, please. Okay. Okay. Sorry, I thought I was getting a question on my phone. So we have got, this is the stratum corneum, which is the outermost layer of the skin. We've got those epidermal layers right there. So these are all the epidermal layers. And then we've got the dermis. In the dermis, we've got that hair follicle running all the way down into that dermal area of the skin. That's the thickermost area of the skin. It's got all the sensory nerve endings there. It has got the blood vessels. It has also got blood vessels feeding oxygenated and deoxygenated blood to that hair bulb right there. That's where we've got the red and the blue. These are the oxygenated and deoxygenated blood feeding that beautiful hair follicle. Okay, and then what we have here are these that we call sebaceous glands. These glands are what creates that sebum that travels to the surface of the skin of the scalp, which is that area there. And that is what helps the scalp have that beautiful ecosystem. Okay, that waxy substance that sits on the scalp is all you need, is all your scalp needs to survive. It doesn't need anything else. If there is overproduction of sebum, we have treatments for that. If there's underproduction of sebum, we have treatments for that. But truly, what we're trying to do, what we encourage, is that we need to encourage sebum production, or we need to control sebum production. The idea is not to start adding things to the scalp. The only other oil that I know so far that mimics the sebum that we have on our scalp is jojoba oil. And so if there is desperation to alleviate anything to your scalp, dry scalp conditions, for example, or whatever, if it's completely urgent for you to do that, jojoba oil would be nice. You put it on the scalp as a treatment and you get rid of it afterwards. Okay, so oils are a no-no to the scalp. Oils for the hair is a different condition. It's a different situation altogether. It's a different discussion altogether. Oils are great for the hair when used right, okay? So there are times when patients will come in and they have issues with dryness in the hair, and they say, I've been using oils all the time, and I've been really trying my best, and making sure that I use my oils, and then we have to break it to them that, in fact, using oils the way that they have been isn't the right way to use oils. Okay. So then the education comes in. How do we make sure that we're using oils properly? We first need to realize where oils sit in our hair care regime. where it actually is helpful. And if so, if it is what you're looking to do, how to make it helpful, how to make oil use helpful to your hair care game. We have to think about moisturization, the act of moisturizing the hair. That is when we really start to see hair thrive, when it's got that beautiful balance of proteins and oils in the hair, or proteins and hydration levels in the hair. Oils are great in helping that happen if it is done strategically and cleverly, exactly how the hair needs it to be done. Not the scalp, but the hair. So we engage in hydration first. You must make sure that the hair is cleansed. Water is introduced to the hair. That is important. So you've cleansed the hair, you've conditioned the hair. So conditioners, as I mentioned before, has got oils and emollients and things in there also, because the act of moisturization must occur in that formulation. So conditioners do have those things in them already. And so where I had that client who turned up with overly saturated hair and scalp with oils, that is an overkill, especially when it is applied on dried hair. So that hair has got no hydration in there at that moment. It's completely dried off, and they've used oil on the hair as a way to get the hair to feel moisturized, where in fact that does not serve any purpose whatsoever, apart from creating a barrier for the attraction of waters from the environment to the hair, or even sealing in dryness. So if if the hair and scalp is dry, let's just say that this client's hair is lacking in moisture, by putting on that oil of that amount, she's coating each hair strand with this oil. Pardon me, which will act as an occlusive barrier. So it will act as a cling film over the hair strands and keep that hair strand covered. But remembering that that hair is already dehydrated. So the act of moisturization is not actually occurring. That's not happening. So to get oils to work on our hair for our benefits, we need to make sure that the hair is hydrated and it has got enough hydration in there, and we use the oils and butters at that optimum time before the hair dries. Okay, there is an argument to be made for greases, for example, the use of grease. I don't know if you remember Dax, for example, Blue Magic and things like that. There are current favorites that people are using a lot, which has got hemp seed in there, which is also really good. You do that when the hair has just been washed and there's some sort of dampness to the hair, maybe up to about 80% of dampness to the 80% dry, so therefore about 20% of dampness, no less than that. So we don't want the hair completely dry. Then you apply some grease to the hair and it locks in that moisture. Again, how much grease are we actually applying is so important. How much oil, butters, and grease we're applying is of really great importance. So what we don't want to do is leave the hair feeling tacky, and the oils, I mean, you don't have to see oils on the hair to know that you have put oil in your hair. That mindset must be changed. So when you're going through dealing with oils and applying them and using them effectively, be mindful of the fact that you've used oil. You've put oil in the palm of your hands and you've rubbed it in. That knowledge is sufficient. you do not need to see the application, or you don't need to see the physical oil on your hair to know that you've put oil in your hair. You applied oil to your hair. So also, this is what I find that explaining to clients is so important, in the fact that using great things in huge amounts, overusing products, overusing things, can have a detrimental effect to the success of your hair growth journey. And so you find that, oh, I'm doing all the great things, I'm doing all these lovely things, I'm putting all these oils in my hair, but I am not getting the outcome that I expect to get based on what I am doing. My actions are not yielding the right outcome. And so then you fall in this vicious cycle of the hair just becoming drier and drier, and there's this loop. Okay, so the act of moisturization must occur. If we're using oils, butters, and greases, we have to make sure that moisturization is happening. Okay, so hair is being hydrated before, yes, and we only do what the hair needs. There is no need to be excessive. We don't need to feel the oils left on our hands when we rub our hands in our hair. We have applied oil, little and often, well, little amounts of oils, and often is better than pouring oils on our hair. I mean, apart from the fact that it weighs down the hair and prevents styling, and, you know, if you can imagine when you use really, thick conditioners that are very rich on your hair, and sometimes if we don't rinse it out properly, what clients find is that they start to have difficulty in managing their hair. And that is because those emollients are restrictive in when we come to style, if they are not thoroughly rinsed off the hair. And so you can just imagine that oversaturating the hair with oils, butters, and greases will also give you some restriction in styling when you're styling your hair. So be mindful of that. Oils, no on the scalp, and on the hair, we must observe the protocol, which is we hydrate the hair first and then we apply the oils. Okay, and I've given some options as well, should you need to use it, and how long you use it for if you decide to use it. So, what causes breakage? Okay, clients and patients will say, I keep seeing small, tiny little hairs on my floor when I comb my hair, or I see tiny little hairs on my clothes, on my person, and I don't understand what is happening to me. My hair is falling out. That is what we call breakage. Breakage can occur when the hair is dry. When the hair is dry, there's a condition called tricotylosis, which is just in simple form, split ends. Split ends is when the hair has split at the end. So right at the ends of the hair, they've split into, sometimes multiple splits can happen on one hair shaft. So tricotylosis is when the hair is splitting. And when that happens, the hair shaft has been weakened by half. So there's a 50% reduction in strength to the hair shaft because it's split in two halves. And so the hair is no longer as healthy and strong and resilient as it would be if it's not split. So if there are no signs of tricotylosis, the hair would be fine and strong. But where there is a sign of split ends, the hair will become weaker. And when it does, those splits will break off. They break off because they're not strong enough to withstand the pressures of just mechanic, handling, day-to-day, brushing, and so on and so forth. Okay, so dryness causes hair breakage, and another thing that causes hair breakage is proteins. If the hair has not got enough proteins in it, or it is over proteinous, it can also become brittle and can break. So hair that is lacking in moisture, hair that is dry, but hair that is also over proteinized will start to break. Other things that can cause breakage in the hair are things like high tension hairstyles. So you put your hair in a high tension hairstyle, torsion is occurring, so the hair is being wound and braided into a style, very, very tightly done, and then it's kept in that style for a very long time. So sometimes I would have clients come in and say, when it was braided, it wasn't hurting my scalp. I was okay, it was not hurting. But there are two things to consider here. Is the braiding technique tight on your scalp, so physically causing discomfort, or is the braiding technique causing damage to the hair shaft? So the braiding technique could not be tight to the scalp, but it may be tight in itself in the way that it's braided. So it could be that the hair has been braided loosely when it's on the scalp because the person is trying to observe gentle ways of braiding, gentle braiding techniques, but they failed when they got to the ends of the hair. So when they're braiding the ends of the hair, the braiding technique itself is so tight that you start to experience hair breakage from the ends of the hair, okay, so from the other zones of the hair. Okay, so high tension styles aren't necessarily just a high tension to the scalp. We're talking about high tension to the hair itself also. So when clients have now become really quite educated about how to have their hair braided on the scalp, and they've become quite vocal to their braiders when they're getting the hair braided by, vocalizing when it is just so uncomfortable. But what they fail to also notice and observe and also be mindful of is the fact that braiding techniques that are tight off the scalp is also something that they need to be mindful of, because that can also cause breakage in the long run. Okay. If you follow what I say in that braiding shouldn't be in your hair for too long, then you don't need your braids to be tight. They don't need to be tight if they don't need to be there for too long anyway. Okay. We have to know that these styles are not supposed to last a lifetime, because when they're in our hair, these protective styles, when they're in our hair, we are not getting to treat our hair properly. We don't get to see our hair, and so we don't get to actually know what our hair needs or what it's lacking or how it's thriving. The hair's been put away, so it's out of sight. We can't keep it out of sight for too long. It doesn't serve anyone if your hair is out of sight for too long. Okay, it's nice to revisit your hair care regime in between braiding. So we don't do back-to-back protective styling. As a hair care practitioner, I refuse clients who come in and have to have or insist on having back-to-back hair braiding or protective styling in that manner. It's just not something I advise. Of course, clients are free to do whatever they want, but personally, I advise against it. Okay, and so Other things that can cause breakage are overprocessed hair treatments. So we're talking colors, relaxers, and perms and things like that, or bleaches, and you're having your hair lightened, for example. If that process has happened, pardon, and your hair has been put under a lot of strain because the process had gone on too extreme, so it's an extreme process that your hair has gone through, your hair will start to experience dryness because we're losing the strength of the hair. We're breaking some of the bonds. Lanthionization is occurring where we're breaking bonds and we're breaking proteins, we're degrading proteins, we're drying out the hair. That cortex, that's the strength, the powerhouse of the hair, has been compromised to the point where it can't hold in moisture and it can't attract moisture. Or when it attracts moisture, moisture leaves again because those cuticle layers of the hair are too raised, or the cuticle areas of the hair are just blown away. And so there are holes in the hair shaft. So microscopically, when we look down the hair shaft, we start to see that there are areas of pockets of holes, pockets that have just been blasted off the hair, and that area is just exposed. And so moisture retention is out of the window, and moisture attracting. So hydrophilic actions aren't going to be present within the hair. Hydrophilic, I've explained before, is just water loving, water grabbing things that can occur for the goodness of our hair and scalp and skin. So colors, relaxers, and over processing of those two treatments and other highly technical chemical treatments such as perms and bleaches, for example, will also cause dehydration and cause the hair to start to break. This doesn't mean that you mustn't do these styles. It just means that when you have done these things, it has to be done with caution. The person who's doing it must be experienced in doing that for you, and so they can tell where your hair is at and how far to go. Sometimes it's a good idea to take these processes over a period of time, or they might say that this is not the treatment for you today. You may need to go into a course of treatments to get your hair and scalp ready for you to be able to have the style that you're looking for. Okay, then I'm going to move on to excessive heat. Excessive heat is also a culprit of making the hair dry. If you use heat on the hair that hasn't been treated well, and you're not using thermal protectors on your hair, which helps to protect the hair from protein degradation, you will end up with hair that is dry. So the hair will feel dry because the heat will allow the waters to evaporate. So the moisture will evaporate out of the hair, and so you end up with hair that is dry. So turning down those heat settings is so important. I promise you, going down a few notches will not make a difference. In fact, I have patients and clients who say, I've turned down the heat and I don't notice any difference. But really what they do is that they put it up high because they think it's a quicker way of getting things done, and and so on and so forth. So we have to change that mindset. We have to get clients and patients to start to think, give yourself the time you need to do your hair. Don't rush doing your hair. Try and make this a pleasure, a pleasurable experience, in that you are allowing the time that is necessary so that you don't rush through the process. Okay? You're giving yourself the time that is necessary. This is why when you go to get your hair professionally done, you notice that the hair looks different and feels different. It's because somebody else is doing it for you. Okay, so we don't have arms in the back of our heads that can actually, do things effectively and efficiently. But also, it takes that a little bit longer when you go to the hairdressers or you go to a hairstylist or a haircare practitioner. They take their time to do it for you, and they focus on you, and they really look after you properly. And so when you're doing your hair, it is good to have that sort of attitude towards doing your hair. So turning down that heat setting. This goes for everybody, male, female, children, whoever. If you're using heated appliances or heated tools, turn it down a little bit, just a little bit than you would normally. You may decide that you're going, high pressure, high heat on the hairdryer, for example. Maybe, turn down the heat and keep the pressure high, or vice versa, or both. Turn down the heat and turn down the airflow, the pressure, okay? And see how that goes. Right. And then I've spoken about emollients and occlusives, the fact that by virtue of the fact that you're putting it on your hair, you're not doing anything prior to make sure that you're infusing the hair strands with the nutrients that it needs. As I've mentioned before in the past, the hair that has come out of your scalp. Okay, I'm going to bring my trusted old model here. The anatomy of the skin. The hair that is here is live because it's connected to the blood vessels. It's been fed. So I made an analogy to a client today, which was that if you keep looking after plants and feeding them all the nutrients that they need, they thrive and they grow and they don't die. And so the hair that is at the active growth stage of the hair growth cycle, which is called the anagen stage of the hair growth cycle, I made a little thing and I decided that we're going to call it ACT because I think it's just a brilliant way of remembering what we're talking about. So the anagen, catagen, and telogen. Anagen stage is the active growth stage. Active growth stage of your hair growth cycle, where we are alive and the hair is living, and those blood vessels are feeding the hair bulb in the hair follicle. Right? And so when the hair is happy and living, it is fine and it's lovely. And we call that hair part, that part of the hair, alive. But the moment it comes out and comes to the surface of the skin, remember the stratum corneum, the outermost layer of the skin. Okay, the outermost layer of the skin, when the hair has peeped out, and this is what we call that hair that has come out of the scalp. Yeah, so this is an example of this, right? And so this hair, which is this hair, is dead. It's dead because it's not protected by this lovely ecosystem of an environment. And so it's not protected. So what we have to do is look after it from the outside because it's revealed and it's come out of the scalp. So we have to look after it. And so when we put emollients and occlusives on that hair that we need to be looking after, we're coating each hair strand with these oils. Each hair strand will be coated with oils, and then it seals any opportunity for other things that is good for the hair from the environment to enter the hair. So we don't want to do that. Okay? We don't want to coat the hair. So emollients and oils, we have to use very, very strategically. I'm running out of time. I can't believe it, to be honest, because I haven't moved on to the other things I wanted to talk about. Okay, so I wanted to talk about children's hair care. I think I'll do that and I'll quickly then go on to skin actives and what they are. So people just wanted to know about, skin active. So I just wanted to say what those are so that we can discuss that another day and go into the deep diving of those active ingredients individually. So children's hair care. Right. This is a sensitive subject for me because there are things that people want to do to their children's hair, and unfortunately they shouldn't, but they don't know that they shouldn't be doing those things. I say to clients, if you're using the right products anyway, your children can use the products as well. So don't worry too much about it. Just get the right product and everybody can use it in the household. Okay? But the styles is the styling is where the issues are. Everything you do for yourself, you can within reason do the same thing for your child if it's appropriate for the child. So with the exception of any treatment that you may have been prescribed for with any ailments of the scalp or the hair, those you must avoid using for somebody else because they were prescribed for you because you needed that, and that's why it was prescribed for you, because you're having a disorder or a concern or a discomfort of the hair, or there's a hair shaft disorder, for example, or a scalp disorder. So you mustn't use those things. But anything else that is for just caring for the hair, those can be used on children. What you need to be mindful of is the styles, those high tension styles that we speak about, and that they are not to be done for an adult. They certainly cannot be done for children. So anything that is over directed, and the one that I want to talk about today is those very tight ponytails. And we have got children with, I need to take a sip of water. This one is a very one that gets me really quite excited. So high tension ponytail. So the child's hair is not ready or long enough to be put into a ponytail. But for ease, for example, for quickness, we're trying to get that child out. We're trying to get their hair looking decent. We over direct the hair. So over direction is it's a fairly simple concept. The hairs stand on end, so they're standing, they're standing like this out of your scalp. If your hair is afro and you've got the fours hairs, for example, they're coily, okay? But either way, they shoot out of the hair follicle, either slightly at an angle, straight, or even flat, right? But what we're doing is we start to over direct the hair. So for a small child whose hair isn't long enough, we start to over direct the hair and we pull it right back into a ponytail. And then we use gels to try and encourage that style, to get that, to achieve the look that we're looking for. That over direction, when we over direct all the hair to meet at a point, when it's not long enough, for example, it means that we have to tie that hair with great tension, and then we leave it there for a prolonged period of time. And what we're doing is children whose hair follicles are young are being trained into accepting that this is what's going to happen to the hair follicles, for example. So the maturity of the hair follicle isn't there because the child is so young already. Things are setting in place. The hair follicle is maturing, but we're introducing styles that's going to affect the child's hair and scalp. Okay, and so this traction alopecia start to occur. The child's hairline starts to recede. They don't have a chance in hell as an adult if they don't even have one as a child when their hair is being treated in this way. And so we must make sure that when we're styling children's hair, we make sure that that style is comfortable. We don't overachieve in, try to overachieve in what we're trying to do for the hair or for the child. There is no need for the child's hair to be slapped down and completely neat with no hair out of sight. It really is not important. What's important is that that child is happy, comfortable, and that those hair follicles are not going to be damaged. Okay, so they're not going to be atrophied by the actions that we perpetuate onto this child day to day, and on the child's scalp day to day. If you have a child that's hair's not long enough, there is no need to try and put it up into a ponytail. You can split the hair in 4s, in 6, in 10s, whatever the case is. Just understand that by over I'm so sorry, I've got hay fever and it's not good. But the point I'm trying to make is that we just need to make sure that the child's hair and scalp is strong enough. But really, is a child's hair and scalp strong enough for those high tension styles? Even an adult's hair and scalp is not strong enough for those high tension styles. So a child's hair and scalp is certainly not strong enough for those high tension styles. So let's try and just start to shift our mindset on what we are doing for our babies. When they're old enough, they can happily enjoy their hair and do things, and at least we've given them a good start, a good chance to be able to have hair that is thriving well enough for them to explore those exciting hairstyles that they want to when they grow up. Okay, so high tension styles, not the thing. Slapping those gels on the hair, it's certainly not going to happen. Those gels dry up and become like plastic films, and they sit on the scalp. And so we need to try and avoid that. Okay. Now, I want to quickly go on to actives. So I'm just going to whiz through that quickly, just so that people know what active ingredients are. I had a question about it in the studio, in the clinic, and I want to address those. So actives are just ingredients that really form like the cornerstone of our skincare. So making sure that they are right there and they're holding us up and really helping us to move that needle to making sure that our skincare is effective. Okay, so we have antioxidants, we have peptides, we have sunscreens and things like that. These are the things that really we must focus on when we're talking about skincare. Skincare, when you're over a particular age, you must start becoming intentional and purposeful in what you're doing with skincare. So antioxidants are, I'm just going to name them, pardon me, vitamin C, vitamin C, vitamin E, things like rosemary extracts, green tea extracts, rooibos tea extract, honeybush tea extracts, those things that when you see those as ingredients in your formulation, in the products that you've got for your skincare, those are what we call actives. Or lycopene, for example, resveratrol is another product that is an active. So these are active antioxidants that are there to combat the free radicals. So if you can imagine like Pac-Man, it just antioxidants goes and eats up all those toxins, okay, on your skin. There are antioxidants, and antioxidants do that in eating up all those toxins on your skin. And then we have peptides. They are like they are like the cell messengers. So they pass messages on, from cell to cell to get the cells to regenerate and repair the skin. Pardon me. So they are cell messengers who go out there and they go into the cell and they pass messages on to get the cells to regenerate and repair. Okay. There are different types of peptides based on what it is that you are using, but we have arginines, we have matrixyl 3000, for example. We have adiphyline, we have neuroproline, riparage, we have what other ones do we have here? Matrixyl, morphomics, for example. These are the peptides that we talk about. So when we talk about peptides, this is what we are discussing. They are the cell messengers. They go in there and they send cells the messages that they need to get them to regenerate and repair the skin. And then we have things like sunscreens, for example. So we spoke about UVA, UVB, and UVC. So the UVA is the aging ultraviolet damage that occurs to our skin. UVB is the ultraviolet damage that happens and that burns our skin. So when you experience sunburn, it's through ultraviolet B radiation. And then you also have UVC, which causes cancer cells to develop in the skin. Yeah, so UV damage, we combat that with actives such as sunscreens, and the ingredients. The list of sunscreens that we need to talk about are zinc oxide, titanium dioxide, octocrylene, and other ingredients, for example. Yeah, so these are the ingredients you should be looking at when you're really looking at sunscreens and things like that. So actives, remember that they are the cornerstones of our ingredients that really help us to look after our skin and gets us to have that finishing touch, that bow, ties the bow to our skincare. And this goes for everybody, by the way, male, female, children, whoever you are, this is great for you. So antioxidants is an active, peptides are actives, and sunscreen also helps in helping your skin glow and look its best. I am so pleased. I think I have done everything that I set out to do today. And if there are no questions about this live today, I will say goodbye, all my love, and good night.